Live from the couch.
8:12 on your Friday morning. Welcome back, everyone. It's estimated more than half of us will deal with receding gums at some point in our lives. But now, a new procedure provides a quick fix to treat the sometimes painful condition. Katie McGee has the story.
For Chuck Milkey, receding gums have been a problem for more than 10 years.
I feel hot and cold quite a bit, so sensitivity. I actually use sensitivity toothpaste as well. It was kind of ugly. I just didn't want to have future cavity problems or tooth decay.
Looking to put an end to the pain, Milkey opted for a relatively new procedure that's been dubbed the lunchtime gum lift.
The proper name for the procedure is the Pinhole Gum Rejuvenation Technique. And the reason it's called pinhole is because we actually make a pinhole and place the instruments through the pinhole that's created, almost like laparoscopic surgery.
The procedure takes about an hour and was created several years ago by Dr. Chao in California. Dr. Bruce Fine in Wayne, New Jersey is the first dentist on the East Coast trained to do it. He's been performing the procedure since August and says it's a much better option than previous treatments.
Traditionally, we would cut the gums and then stitch the gums up and back into position after taking some gum tissue off the roof of the mouth. With this technique, we don't have to do any of that.
Instead, Dr. Fine uses a tool to loosen and move the gum around the tooth. Next, he places a collagen strip through the hole, which helps plump up the tissue, holding it in the proper position.
We are able to do up to 10 teeth at a time, while with traditional techniques, all we could do is really 2 or 3 teeth at a time. And with the traditional technique, it was really hit or miss. This technique is virtually 100% successful, and we have immediate results. We immediately raise the gum into the position and it stays in place.
Linda Good had her lower teeth done recently. Having repaired her gums the old-fashioned way in the past, this was a much different experience.
It's easier, it's quicker, you're in and out of the chair, you don't have any swelling, you're not black and blue.
Which means Milkey may be able to put an end to his pain.
I can probably get more of them done in a year. I can probably get all my gums done back to where they should be.
But it's not necessarily permanent. Dr. Fine says gums may recede again, but since the collagen thickens the tissue, it may help to slow that down. He says the procedure is usually covered by insurance, which is also good news.
That's great news.
Yes.
I have this issue. What causes these receding gums?
A variety of issues, actually. It can be due to gum disease. Genetics can sometimes play a part here. If you are someone who clenches or grinds your teeth, especially at night, but it can all come down to your toothbrush. And we were talking about this before the package aired.
Yes.
If you're using a hard toothbrush or if you're brushing too hard, you can cause your gums to recede. And Dr. Fine said that if you brush regularly, plaque really comes off pretty easily, so you don't have to get in there and dig.
My mindset is like more is more.
Yeah.
Brushing your teeth, more is not more. With the hard bristles,
brush
too
often,
hard.
but brush softly.
Yeah, in light circles.
There you go.
Thank you,
You can
Katie.
do it.
Thank you, Katie.